Another common problem that we see with low back pain patients is their inability to contract and control both their pelvic floor and their very deep abdominal wall, known as the transverse abdominis. So a really simple exercise to begin to use the connection between your brain and the muscles and to learn how to control that is this. You're going to be lying on your back first off, knees bent up. Now, in that position first we're going to learn how to contract the pelvic floor. Now, in order to do that, there's a number of cues that we can use to try and get a contraction of the pelvic floor. Some people will describe as imagining you have a drawstring bag, and if you were to pull that drawstring bag together, or imagine sucking everything up this way. The easiest way to know how to contract it is if you're going to go to the toilet, and then how would you stop yourself from going? And you can practice both, as you would say, stop the pee and stop the poo. And you can try to contract the muscles for both. Really simple, and you're just going to hold that contraction as hard as you can for around 5 seconds. Personally, I find the easiest way to think about things is draw everything together and up from my pelvic floor, up and into the abdomen, and hold that position. Another term that people may use is to bear down. If you were to bear down, that's also going to use the pelvic floor. Whichever connects with you, you'll know when you feel it, you'll feel that pelvic floor contraction, and just learn to hold that for a few seconds. In order to then use the transverse abdominis, we need to create a vacuum in the abdomen in order to contract that muscle. So what you want to try and do is actually take the space between the front and the back and make that as small as you can by literally sucking in your belly as hard as you can to make that space as small as possible. In this position then, you can then take a full breath in, but try to maintain that sucked in position. And then as you breathe out, you squeeze as hard as you can through your abdomen or through your abdominals in that sucked in position. So you'll take that position, you breathe in, and it should be really quite hard, almost feel like a cramping in your abdomen. Then the idea is if you can learn to contract both at the same time. So you can squeeze your pelvic floor up, suck belly in, and then breathe in, and out. Squeeze, hold for 5 seconds and relax. And again, a good starting point is 5 repetitions of a 5-second hold as hard as you can to really build up not only the connection to that muscle, but some base isometric strength. And this is really helpful for those suffering with ongoing back pain. Just to elaborate on that point, what we can see is that with the low back, you need 3 levels of support. Your diaphragm, your breathing muscles, your abdominals, and your pelvic floor have to all work in synchrony to stabilize that spine. Hence, we want to work on the deep abdominal muscles as well as the pelvis.